Hello and welcome, dear learners, to the NIPTIL course on Healthcare Quality Management. I am Professor Dr. Dhananjay Mankar from Tata Institute of Social Sciences. Today we will be dwelling into the healthcare quality journey of infection control and patient safety. For the first module of Healthcare Quality Management, Infection Control and Patient Safety, we will be dealing with the foundations of healthcare quality and infection control. We'll be talking about the foundations of healthcare quality, where the global definitions of healthcare quality by World Health Organization and Institute of Management perspectives will be taken ahead. The 6 core domains of healthcare quality, safety, effectiveness, patient-centeredness, and timeliness, efficiency, and equity will be taken ahead. The global definitions of healthcare quality, where the WHO defines quality of healthcare as quality of healthcare refers to the degree to which health services for individuals and population enhance the likelihood of achieving desired health outcomes. It is based on the evidence-based professional knowledge and it is critical for achieving universal health coverage. As we see in India particularly, we have a lot of issues with respect to quality with the two-tiered system in our country, which is divided into private and public hospitals, where we find that quality is even contributing to equity. As countries commit to achieving health for all, it is imperative to carefully consider the quality of care and health services. So, quality of health care can be defined in many ways, but there is a growing acknowledgement that quality health services should be effective, it should be safe and people centered. If we do say that how it is effective providing the evidence based healthcare services to those who we need actually, which is very important in quality, and where we find that quality in safe and avoiding harm to the people from whom the care it is intended. There is an expected burden to see that patient-centered approach towards quality is one where providing care that responds to the individual preferences, needs and values. To release these benefits of quality healthcare, health services must be always be expected to have a timely, equitable and integrated and efficient approach, where we find in terms of timely reducing waiting times and sometimes harmful delays which are very common in hospitals and which are encountered very frequently. Equitable care, which is one and need actually, which states for providing care that does not vary in quality on account of gender. We find a lot of gender gaps, ethnicity issues and geographical locations, socioeconomic status which do contribute a lot to affect the equitable care. The integrated approach which is expected providing care that makes available to full range of health services throughout the life course. The efficient expectation is more with maximizing the benefits of available resources and avoiding waste. So, the definition of WHO more points towards a comprehensive approach towards healthcare quality, and the healthcare institutions are more trying to abide to take this integration. The second institutional definition of Institute of Management in the US defines quality care as the degree to which health services for individuals and population increase the likelihood of desired health outcomes and are consistent with the current professional knowledge actually. So, if we do take the health services in general, where the main emphasis of the Institute of Management definition, it is said that acute, chronic, preventable, restorative and rehabilitative care are only a few of the many services that are included in healthcare quality. So, we find that it is more taking ahead to a lot of many services which are there in quality. The different healthcare professionals offer these treatments in different locations. And we find that additionally the definition over here of Institute of Management placed more emphasis on populations and individual than just patients. So it is expecting much more than the patients. This change improved the relationship between prevention, quality and the healthcare promotion. So there are integration of prevention, quality and health promotion. So coming to the next discussion on 6 core domains of healthcare quality. So the first comes with safety, where we try to maximum influence preventing patient injury. So the basic principle of healthcare is patient safety is do no harm. This is a notion that we have been taking, that making sure that patient doesn't sustain unintentional injuries while receiving medical treatment, which is vital. So it is expected that when a patient comes, it is always there that the patient safety becomes a priority actually in quality. And in order to improve its own procedure, healthcare industry frequently takes inspiration from safety procedures. The safety procedures which are taken from other industry like aviation industry, manufacturing industry, and it has been found that the lessons of healthcare quality are being taken majorly from aviation industry. We find that emphasis on patient, particularly over there, it is more the customers, and here in healthcare domain it is more the patient. There is an increased benefit of the modern technology that has been there for patient safety, particularly in quality, that is electronic visit verification, that we call it as EVV. So is one an example of modern technology that has significantly improving patient safety. For example, this electronic visit verification in home health adds more accountability by ensuring that patients receive their recommended healthcare in a timely and appropriate manner. So such of these tools are useful, and because of this it is made very simple, and technology serves as a safeguard against any errors. So we do find a lot of integration of technology which has come up actually, which is much more taking a stake into quality, where we find electronic visit verification and other developments which are encouraging in health technology, but there are still hazards in healthcare which needs to be encountered. Organization must address issues such as medication errors, hospital-acquired infections, and procedure-related consequences. Where medication errors are much more contributing to patient safety, hospital-acquired infections take more stake into hospitals, particularly where we find that the length of stay of a patient is more connected with the hospital-acquired infection, which we call even as healthcare-associated infections. This calls for constant attention in detail, training and process development, which are the need where we have to increase the quality. The second in this line comes the effectiveness, which is more delivering the evidence-based care. The clinical judgment should be based on the best available scientific evidences which are a need of an hour, which is being looked towards healthcare, and according to the concept of evidence-based care, which is gaining a great importance. Healthcare workers must go through a lot of data in today's age of abundant information to determine what is pertinent and useful to the patient. So we can say that it will be more a data-driven decisions that will be taking more the effectiveness of the care that is being taken ahead in the current times. And thereby we find that evidence care on the basis of today's knowledge actually might be like the knowledge which has been derived from the previous time. So being effective guarantees that the patient obtains successful therapy. Yes, it is. It is to be increased and in seen that the trust which is being in addition is more because of the greater results that we will be gaining. So when patients are aware that their care is supported by reliable evidences, they are more likely to participate, where we expect that patients' contribution in patient safety is much needed. And adherence to the protocol is one need that patient can take more patient safety in their hands, where the accountability can be a major part of that. It might be difficult to stay up to date with the rapidly evolving medical literature, which is one thing that most of the time the healthcare workers get exhausted, and they find that what is to be learned a lot, and the voluminous increasing in the medical literature is going a lot. So healthcare organizations need to encourage a culture of curiosity and learning and place a high priority on continuing education, where we find that most of the in-house training are going rapidly to the need of the current healthcare. The reason is that healthcare organization needs to get updated, and the culture needs to be fostered actually for learning. The third come in line is the patient-centeredness, which I would like to emphasize particularly with preference to respecting the care, where there is a question of dignity. Despite the scientific foundation, we find healthcare is a human effort. Lot of technology has been driven, lot of processes has been driven with the help of the data, but a human touch is one which gives more patient-centered approach. By placing each person's particular needs by values and preferences at the forefront, all the healthcare encounters patient center, which recognizes more a value where patients are one a priority and patients always will be a priority. This method of patient approaches from the perspectives of parentalistic paradigms, or nowadays we can say patient actively participates into the medical journey, which might be thing that you more or less actually gives patient more a priority, or listen to them carefully, try to be more resilient and make patient more accountable for their decisions what they are taking into the healthcare. In addition to increasing the patient happiness or listening to or acting upon patient tales frequently, so it is more like your health outcomes to the patient will be more into the hands of patient and you will be the one who will be facilitating. So I want to recall to all those healthcare professionals or the learners or the students who will be taking this ahead is that you try to make concentrate on the patients and the patient's relatives. However, the objective might be hindered by communication problems, that healthcare communication is in need of an hour where we have to emphasize more on the obstacles of those communications, which becomes very prime in terms of the time limits that we give to a patient. So what is the expectation? You need to concentrate more on listening to the patient, communicating with them with compassion. Lot of empathy is a need. Adaptability to the constraints actually that they are facing in the hospitals or healthcare institutions. In a way, we are trying to see that there should be a commitment from healthcare systems and providers to overcome these challenges, because majorly a time that you may not be at the first time of the providers might be in a group, might be in a team or the institutions. So provider needs to come up with those challenges, they need to think on that part where how this are one a part of that part. The next in line comes the timeliness, which is cutting down on care delays, which is very frequently observed in Indian healthcare settings. Lot of our hospitals are facing this issue, and we do encounter that if we take the feedbacks of the patient, they will be ideally saying that timeliness is one which matters a lot to us. In the medical field, every second counts. The literary meaning is not only counting, but it has to be paid. So the seconds have to be paid means like it is even from the patients to have. So whether it is an urgent medical issue with like coming to your emergency department or to your triage or to your routine examination that the patient is coming to the OPD. So there should be a prompt and might mean that difference between getting better or getting worse. Sometimes the patient may get more worse when they come to the hospital rather than being at the home, or sometimes they may get more better after seeking a proper medical care. So how resilient, how open, how listening or how good the healthcare institutions are, it devoids from the timeliness. But sadly, the delays are all too frequent and are frequently brought on by the overloaded system. If we do talk about Indian public hospitals, we encounter that timeliness is one of major issue, and Indian public institutions are very much overflooded. This can be a problem in even metro cities about private hospitals or even corporate hospitals also. The difficult administrative task fuels the thing more and even logistic problems. So if you do encounter overloaded systems, difficult administrative tasks and logistical problems make the timeliness a major issue to be counted in quality. The delays in receiving care can have serious repercussions. So the repercussions has to be faced in terms of litigations, might be hassle, might be vandalization and lot of issues where frequently leading to deteriorating the health condition and even higher expenses. So both the way, even the hospital is getting affected, even the patient or patient's relatives might be getting affected. A multifaceted strategy is needed to address this problem, including enhancing collaboration between healthcare teams. So you are expected that the healthcare quality team and the team from the admin or the team from the back end or the team can be from housekeeping, the team can be even from operations and so on. Along with that, utilizing technology to diagnose patients. So technology saves the time? Yes, it is one of reason actually we find that a lot of diagnostics which are increasing, and with the help of the high-end medical technology which is in the coming days is making more quicker, more simplifying the administrative procedures. So administrative procedures are one which are more dependent on the technology, and in the current days we find that it is that technology will be one science actually which will be taking major stake into healthcare and hospitals. Next come into this discussion is the efficiency part, which I want to more emphasis on how it is preventing the resource wastage. So are we expecting that there are resources which are getting wasted? Do we need to think about optimal utilization or sustainability even in healthcare? Yes, it is. The opposite of quality is inefficiency. So you can emphasize to say that it impacts the lives and potential in addition to the finances in the healthcare industry. Yes, we find that quality pays a lot. We need to pay a lot for quality. So the thing comes that when human and financial resources can be drained by administrative redundancies actually, or excessive training and underutilization of preventive measures, which are one of faults which are counted, and many times the administrator put all these things into their discussions, which makes much a reason that efficiency is more drained. So we have the benefit of lean methodology or the lean philosophy, I mean to say, which can be implemented, which counts more to reduce the errors. First to understand the errors and then to reduce the errors. What is the lean methodology to be implemented? It is more through the thorough assessment of the present procedures. What are the present procedures, how they are being completed, and in order to increase the efficiency, you have to work on those procedures. The entire gamut of lean methodology is working on the process, is on seeing and making the processes more clear. The object is straightforward: to deliver the best possible care while minimizing waste and making efficient use of the available resources, including the three components which are always very important in healthcare quality, that is time, money and expertise. The next incoming line is equitability, maintaining quality despite differences. So as I said earlier, that equity is one which is very strongly connected with quality. Equity in healthcare emphasizes the racial, socioeconomic, gender, and other personal characteristics that shouldn't be affect the quality of services. We do find a lot of issues of racial, socioeconomic, gender, and other personal characteristics which are being more encountered by Indian healthcare systems. We do come up upon a lot of examples that people are being discriminated. Access to healthcare has become very difficult for certain genders, particularly in women. Socioeconomic status has one reason that people are denied with care. Lot of personal characteristics, particularly in terms of body, color, and all those, which shouldn't really affect the quality of services. People should not be denied or be being treated in this way. The second reason in this line continually comes with the background. The two patients with comparable health problems should ideally receive the same care, where we find that the patient being having the same health problems are ideally treated different on the basis of their background, even basis of the name, basis of the color, on the gender and other things. However, these gaps are and will have some or the other way still persistent. Certain underprivileged communities encounter obstacles that restrict them there to access and results. So we do find that there is a marginalization of certain communities. There is underprivileged who are being not taken into the mainstream. Recognizing these disparities and comprehending on their causes and developing plans to address this issue of equity is a major concern of quality. So it is a quest for justice, making sure that everyone should get the treatment that they are entitled to. So do we need to talk on justice? Yes, it is though, because although unique, every area is related. When combined, they form a fundamental elements of healthcare system, where we expect that it should be prompt, it should be efficient, it should be equitable, safe and patient-centered. So you can combine the entire gamut actually with the help of all this. So all these 6 areas must be kept in mind when healthcare institutions and provider evaluate and enhance their treatment as the landscape shifts on. We find that a lot of growing needs of healthcare professionals and the complexity which is increasing, it is making more expert care to be coming on. Lot of technology driven supports are there. Lot of emphasis on high end technology is there. But the major fundamentals to cater the sort of care actually the patient is expecting will be the same. Thank you.